Welcome everyone to NTF Live, and I'm privileged to be your host. I'm Judy Dukeshire. And so it's exciting to have this topic as the focus of our discussion today, because it's so evident that we need to understand the concept of resilience as much as develop it and nurture it. So I'm thrilled that I have the most amazing speaker profile right now talking to you from the US and Canada about resilience as a concept and resilience in nursing. So I wanted to actually start by initiating a poll just so that we get a sense of where everyone is coming from. So I'll just launch that. And if you could all just respond to that, that would be great. Okay, well, we have a good sense. It's a nice spread, actually. So it looks like the majority is nursing leaders. For those of you who can't see it, hopefully I'll just share the results and they'll come up on the screen for you. So the majority are nursing leaders, followed by nursing educators, new graduates, and students. So it's so wonderful to have all of you here, and looking forward to sharing the next hour with you. Just a point of moving forward, we are really excited to have this panel today. So we would greatly appreciate if you could offer your comments about specific parts of the presentation that you really appreciated, things that resonated with you, and we'll be able to share those in an email to everyone after the event is complete. So thanks very much, everyone. All right, well, it's my absolute privilege to introduce you to our first speaker, Dr. Robert Wicks. Currently resides in a suburb of Philadelphia, Pennsylvania, and is the author of over 60 books, many of which I own, with bestsellers that include Riding the Dragon, The Resilient Clinician, that's the second edition with Mary Beth Burdell, Bounce, Living the Resilient Life, Night Call, Embracing Compassion and Hope in a Troubled World, and Perspective, The Calm Within the Storm. Dr. Wicks received the first annual Alumni Award for Excellence in Professional Psychology from Widener University, and is the recipient of the Humanitarian of the Year Award from the American Counseling Association's Division on Spirituality, Ethics, and Religious Values. So welcome, Dr. Wicks.
I don't know what your destiny will be, but one thing I do know, the only ones among you who will be really happy are those who have sought and found how to serve. And I think this is true, especially for professional nurses today. However, as you know, it doesn't mean that your rewarding work is easy. And so it's an honor to speak to you today about secondary stress, the pressures experienced in reaching out to others. And the overall goal I have is to offer encouragement to you to begin a more serious dialogue with yourself and your team around resilience, self-care, and maintaining a healthy perspective. Those in professional nursing are at a difficult point and have a danger that is unusual for one reason: your commitment. Swiss psychiatrist Carl Jung put it this way: the brighter the light, the deeper the darkness. And so, because you're so committed and talented, the tendency is there to deny or intellectualize or seek to avoid or minimize the impact of being a nurse. But that kind of attitude doesn't work. It's easy to lose your way as to why you're doing what you're doing, even if you have very valued goals. When I was in South Africa, speaking on resilience after apartheid, someone came up to me at a break and she said, "Well, I can't do it anymore." I said, "Well, what is it that you do?" She said, "I'm a social worker and I work with women who've been sexually and physically abused, and I need to get them justice. So we need to go to court, and they need to take a day off from work, and they're poor and they're often single parents, but they want the justice. So we go to court." And the last time we went to court, I presented the papers to the judge, who was male, and he looked at it and said, "Well, I haven't had time to read it. Make another appointment." She said, "I'm a failure. Well, I let the dust settle because she was pretty upset. And then I asked her, I said, well, who was with that woman other than you at that moment? And she said, well, no one. I said, well, would it be an exaggeration to say that you were closer to her at that moment than anyone else in the world? She said, no, it wouldn't be an exaggeration. And then, in as gentle a voice as I could muster, I said, and you want to leave that? I said, don't you realize we are not in the success business? We're in the faithfulness business. And this is important. How can we be faithful if we're not resilient? So, what I want to share with you is not really new. I don't do new. But what I'd like to ask you to do is something quite unusual. I'd like you to listen to what I have to say as if you haven't heard it before, with a sense of openness that has a virtue at the core of it that we don't hear much about in healthcare today, society, actually. And you might say, well, what is the virtue? What is the signature strength? Well, let me tell it by way of story, because even if you want it, doesn't mean you'll have it. A number of years ago, my daughter was sitting at dinner with her two daughters at the time. My grandchildren were about 4 and 6. And she said, before you leave the table, she said, I'd like to ask you a question. What gifts do you think you've been given that you're going to share with your classmates in the world someday? And they love these exercises, so they launched on and on about all their gifts. And finally, my son-in-law, who hadn't said anything, said, well, what about humility? And the little one said, well, what exactly is it? And he said, well, get the dictionary. So he read the definition of humility. He said, now, who do you think of when I read that? And my two granddaughters and daughter chimed up, Mom, referring to my wife. And he said, well, what about Pop? And they said, no, not Papa. So even if you want this virtue, doesn't mean you're going to get it, but it's important because when you take knowledge and you add humility, you get wisdom. And when you take that very wisdom and add it to compassion and caregiving, you get love. And love is what brought you into nursing, and it is what will sustain you. So let me quickly present a number of themes through this brief presentation. I say quickly because when I was invited, I said, do you want me to be informative? Do you want me to be inspirational? Do you want me to be humorous? They said, no, we want you to end on time is what we want. So I'll try to do that. Furthermore, I want you to know that the themes I'm about to discuss are not just about you. They are really about you having the basics of resilience, self-care, and maintaining a healthy perspective so you can take better care of your patients and interact in a more healthy way with your colleagues and family and friends as well. Because one of the greatest gifts you can share with others is a sense of your own peace, inner resilience, and a healthy perspective, but you can't share what you don't have. That resilience in you is going to be transformative for those you treat. I was treating a woman who was sexually abused as a child, and I was seeing her as an adult. We came to the end of the treatment, and I wanted to make an intervention. And I wanted to think it through because when I supervise psychiatric nurses and psychiatrists and other mental health professionals, I say to them, when you make an intervention with a patient, I should be able to ask you later in clinical supervision, why did you say that? Why did you say that now? Why did you say that now? And why did you say that now in that way? Don't tell me it was intuition. That builds on discipline as a helper. So I said to her, you know, let's stop for a second. Picture my face as a mirror. What do you see? And she said, oh, I see a woman alive with the spirit, a woman who's resurrected that little girl that was lost because of the abuse. And now she's integrated her with the woman she is now. And because of it, she's hot stuff. And I said, well, yes, you are hot stuff, but how did you get to this point? You weren't this way when you first came in. And I just thought she would go through techniques that she had learned. Instead, she said, oh, it was simple. I said, simple? She said, yeah. The first time I came in here to see you, I simply watched how you sat with me. And then I began sitting with myself in the same way. Maya Angelou put it this way, they may forget what you said, but they will never forget how you made them feel. But you can't do this if you're not resilient yourself. Not being aware of secondary stress can be dangerous, particularly in its acute form, when you're dealing with death, dying, trauma. When I was working in Germany with military caregivers that just came back from the war zone, a full bird colonel came up to me and said, "Before you speak about resilience, you need to know there are a lot of ghosts in this room." I said, "What do you mean?" He said, "There's nothing left inside them." Acute secondary stress. Let me add, though, something interesting is I think chronic secondary stress, what we call burnout, is even more dangerous. The Canadian philosopher Marshall McLuhan once posed the question, if the temperature of the bath rises 1 degree every 10 minutes, how will the bather know when to scream? In healthcare, we don't know when to scream today. We need to recognize, and this is important, that the seeds of compassion and caregiving and the seeds of burnout, chronic secondary stress, are the same seeds. Nurses who took epidemiology courses years ago probably remember being taught that for every case of poisoning, there was a dozen cases of subclinical toxicity. Well, what does that mean for us today? Well, I believe that what it means for us today is every nurse should be concerned about secondary stress, not just severely impaired nurses. What we need to appreciate is for each one of you experiencing severe secondary stress, there are at least a dozen of you on the edge of some form of burnout. Given this danger, I think it's crucial that you have a healthy perspective, especially when facing both challenges and necessary change, because it's not the amount of darkness in the world, in healthcare, in your family, or even in yourself that matters. In the end, it's how you stand in that darkness. In other words, gaining, regaining, and maintaining a healthy perspective is crucial, especially when dealing with the one constant in life, change. As author and poet Kathleen Norris once noted, when you turn your back on change, you don't recapture the past, you lose the future. And this is the case with post-traumatic growth. What happens is after a trauma, after this big change, the call for the person experiencing these difficulties is twofold. First, is to don't play it down, face it, recognize that it is really terrible. Then second is to be open to where it can take you. And I think that is very important with stress. Where will it take you? Another theme is contagion that I'd want you to remember and reflect upon with your colleagues. You know, we talk about physical contagion in nursing and medicine, but it's also psychological and spiritual contagion. We can experience what is called in my business parallel process, and it occurs when we begin to mimic the negative patterns of our patients as well as the negativity of those with whom we live, work alongside, or are supervised by. When I was asked to go into Beirut to work with caregivers from Aleppo, Syria, that they brought there so I could speak to them through an Arabic interpreter, I noticed they were experiencing traumatic countertransference and transference. Traumatic countertransference because the people in Aleppo were asking things of them that they couldn't deliver. And rather than doing as you normally do and saying, this is what I can do for you, but we will look at who else we can bring in, they try to be God. And as a result, they were overwhelmed, they were angry, they were helpless. And then they came in and they transferred it on to me. And when they transferred it on to me, I recognized the danger of being overly empathic with them. And I said to them, look, I've worked in Cambodia, I've done the debriefing of people, relief workers evacuated from Rwanda during the genocide, but I don't know your pain individually. But I hope you can gain something from my sharing with you. I think that it's also important to have a sense of detachment in your work and interaction with negative people. You see, the opposite of detachment is not compassion, it's seduction. We're seduced by the crazy expectations of others and the emotions we have to deal with. I'm not asking you to be callous. But you need to recognize that in the Eastern European proverb, when you sleep next to the cemetery, you can't cry for everyone who dies. Detachment is part of a triad. You lean back, you reappraise, and you renew so you can keep working. In line with this, you need to appreciate, the reality and eventuality of failure. You're going to fail. The more you're involved, the more you're going to fail. When I work with surgical residents, I say to them, you're going to kill people in the work you do. Not probably by malpractice, but mispractice, because it's impossible for you to be on an A level 100% of the time. So we need to do what we need to do to understand that is a couple of things. One is we need to have a self-care protocol, and that's discussed. We don't have time for it here, but it's discussed in the book Overcoming Secondary Stress in Medical and Nursing Practice. What I do want to tell you here is we're the worst at self-care. We're the worst at it. Humorist Irma Bombeck once said that any man that watches 3 football games in a row should be declared legally dead. The reality is that we almost metaphorically, psychologically, and spiritually eat or enjoy whatever comes along rather than taking the time to do a self-care protocol. I will emphasize 2 things and then wrap up. The first in a self-care protocol that's essential is alone time. There's a real need for you to take at least 2 minutes a day in silence and solitude and wrapped in gratitude to center yourself. Now, you might say, only 2 minutes? Well, how long are you doing it now? Regularity is more important than length of time. And I think that what will happen to you is that it will let you realize those areas where you're not reflective. Anne Lamott, who wrote Funny Stuff, said almost anything will work if you unplug it again for a few minutes, including you. But she also said, my mind is like a bad neighborhood. I don't like to go there alone. So there are 3 dangers when you sit down in silence. One is arrogance, where you blame other people. You give away the blame, you give away the power to change. Second is ignorance, where you condemn yourself. That's no good. And third is discouragement, which is the last home of the ego. I'm encouraging that you look with the sense of intrigue, and that will increase your emotional intelligence, where you look at your dysfunctional thinking, see how it affects your emotions and actions, and reflect on how you can control, handle, and express your emotions in your interactions. The other piece that I want to emphasize is friendship. There's a Cameroonian proverb that goes, if you want to go fast, go alone. If you want to go far, go together. I think we need 4 types of friends. The prophet that says what voices are guiding you, the cheerleader that encourages you, the harasser or teaser, because on the way to taking your nursing seriously, you can do a detour and take yourself too seriously. And finally, the inspirational friend that calls you to be all that you can be without embarrassing you that you are where you are. So given all of this, all the challenges, where do we begin? I think by asking ourselves 4 questions. First, what aspects of your work and personal life are most challenging and stressful? It's going to be different for each of us. Second, what does your self-care protocol look like? It has to be realistic and ambitious. Third, what approaches to dealing with increased pressures have you found most helpful? And that's good in team meetings because you have such wisdom. Why not share it? And finally, how can you improve the ways in which you approach your work and personal life so they can become more rewarding? Important questions to reflect on. Thank you very much.
I could listen to you forever, Bob.
Thank you.
And thank you. Thank you so much for that wisdom. And I can guarantee you, based on that, that your grandchildren probably think you're a pretty humble person now. Thank you very much, Bob. And I can't think of anyone who is better to follow that. Certainly wouldn't want it to be me. But we have a blessed guest with us today, Dr. Gloria Donnelly. Dr. Donnelly earned a BSN from Villanova University, an MSN from the University of Pennsylvania with an emphasis in psychiatric nursing, and a PhD in human development from Bryn Mawr College. Dr. Donnelly has been the editor-in-chief of Holistic Nursing Practice for over 45 years, is the author of 7 books, and the winner of 2 American Journal of Nursing Book of Year awards. Dr. Donnelly is Dean and Professor Emerita at the College of Nursing and Health Professions at Drexel University in Philadelphia from 2000 to 2017, and recently teamed up with Dr. Wicks to co-author the 2nd edition of Overcoming Secondary Stress in Medical and Nursing Practice. This contemporary publication, of which we're giving out 2 today, offers insights into how nursing and other healthcare professionals can extend their presence to others without losing their own inner fire in the process. Welcome, Dr. Donnelly.
Thank you. I want you all to know that I just declared my husband legally dead based on Bob's criteria of 3 straight football events, which is a good lead in to my discussing with you one particular strategy I think really will help you to deal with the stressors, deal with your own, let's say, stress demons in the work of nursing. I read this morning, for example, that 25% of nurse leaders, that is managers and above, are considering leaving the profession because of the stresses and because they don't have what they need to do the job. Now, I don't know exactly what that means, but let's focus on the individual and what you may need going forward to really build your resilience, embrace your nursing role, and really offer the kind of care to patients that you need to offer. So Aristotle said 2,000 years ago, the unexamined life is not worth living. And I think that's true. It's what Bob just encouraged you to do, to really look at yourself. And what I might suggest is when you get a copy of Overcoming Secondary Stress, you start with the medical nursing professional secondary stress self-assessment questions. There's 60 wonderful questions in this assessment guide. You could do 1 or 2 a night, and at the end of 2 months, you'll have a picture of how you perceive your own stress. So perspective, your own self-perspective, your own self-care assessment, knowing your tendencies to make decisions on how you're going to behave, and deciding, because all of the control and the decision-making is within your power. Nobody can really make you do anything. They can influence you, and you weigh the pros and cons of taking one action or another, but no one can really make you. So I want you to reflect on control, who has it, and what can be done with it, but then give you the message that you are in control. I've worked with nurses probably for 45 years in my career, going around the country. I used to on control. And you know, inside of an operating room suite, there's limited control because of patient safety. And so focusing on control is extremely important, particularly in a setting where tensions run high because risks are high. So what I'm going to focus on now is not the whole range of stress management techniques or building resilience. I'm going to focus on humor, because what I believe is you can have fun while you're changing. Think about if you go to the next slide, Judy, think about your own environment, your own work environment. And what is your own humor orientation? Are you a quote fun person? If you work in pediatrics, have you learned how to be silly? Because silliness is important when working with young children. Is it possible to have no sense of humor at all? I'm sure you're thinking about people that you work with or people in your family that you perceive might not have much of a sense of humor. And can you assess sense of humor? Yes, you can. Just go to Google and put in humor assessments and have fun. There are at least 50 online that I've looked at. And you can really kind of get a sense of what are the elements of a sense of humor. When I was a nursing student, particularly as I moved into psychiatry and maternal child health, I don't know why these two, I had instructors who taught us that we were not to enter the patient's context when it came to humor, that we were to remain objective because the nurse was a blank slate. And in that relationship, all of the energy would come from nurse to patient, but not back. And I've looked into that over the years. I don't believe it. I've skirted around it. And I do believe that humor can potentiate patient and staff relationships. I remember in psychiatry sitting with two patients one day, two very psychotic patients, having lunch overlooking the expressway. We were on the 15th floor of this research center. And the one patient looked down and she said, "You see that truck? You see that truck there? That's my van. I own that van. I'm the head of a van line." And the other patient looked at her and said, "Well, get your trucks off my expressway." And we all laughed. Actually, we laughed raucously. And what happened after that? The three of us formed a kind of bond. And after that humor event, we even had a normal conversation. So what is it about humor that frees up rigid cognitive perspectives or even the rigidity of psychotic thought? And I've always thought about that, and I use that example, particularly with students. There are some organizational cultures that suppress humor or even use humor in negative ways to belittle. And you have to think about the culture that you're working in and how open it is to humor. So what types of humor are most effective in promoting healthy work environments? Next slide. I can't possibly go through the details of all of them because of our time constraints, but certainly humor connects you with other people. I know there are staff members that you can have a good laugh with. Humor is for tension relief. It's for understanding the situation, for creating perspective, and for even promoting humility. When we can laugh at ourselves, it means we have a good degree of humility and our relationships are probably better. It's for speaking truth. And many of you probably remember sitting in meetings with kind of pompous people. I certainly remember that, having been a dean 3 or 4 times, sitting with other deans. And I remember in one setting, I was a new dean. I was the only woman dean in the group, and I was very active in the conversation, and I noticed a pattern. I would say something, I would offer an opinion about something, and about, I would say 2-3 minutes later, this other dean, a relatively young man, would say exactly the same thing I had just said. And everybody would kind of look at one another, but nobody would say anything. And then we would move on. And this happened over and over. And finally, one day I thought, if it happens today, I'm going to address it. And it did. And after he spoke and finished, I said, I think there's an echo in this room. And everyone laughed hysterically, including the person that was repeating my statements. We moved on and it never happened again. Now, I could probably write a paper on what happened there, but sometimes when you speak the truth, it's pretty funny. But of course, you have to muster courage to do that. And so it's about deciding, taking a chance. It's about also using humor to cope. And one more story. Gallows humor is often used in healthcare. It's where we kind of make fun of horrendous situations. And I remember I was director of a hospital school of nursing, and I used to work an evening shift once a week, making rounds to see where the students were working in the hospital in the evening and what really they were learning. Were we kind of lining things up with what they needed to learn in their program? And I had developed a relationship with this wonderful ER fellow, a resident, and I would go down to the ER, probably my last stop in my evening rounds, and I would say, so what are the students learning tonight? Anything very dramatic or unusual? And one night I went down to the ER and it was a buzz with police and red lights outside the ER, and people were just running around. And I went up to the resident and said, what's going on? My gosh. And he said, a limousine pulled up in front of the ER doors, and the back door of the limousine opened, and somebody pushed out a garbage bag that had a body in it. And the limo pulled away. And he said, I guess it was a mob hit or something like that. I said, oh my God. I said, so he said, yeah, the body's in that room. I said, so it was gunshot. He said, well, we're trying to determine whether or not it was suicide. I said, suicide? He said, yes. He said, we're just trying to determine how he got the twisty on the outside of the bag. Well, we looked at each other and we laughed. And I realized in that moment how much he needed to laugh after that horrendous 2 hours of having to deal with this situation. So sometimes when you have a close relationship with someone and you're not spouting this kind of humor to the group, it's appropriate because it provides release. There's humor in self-effacement, making fun of yourself, like the nurse who was ordered by an old-time physician to wear her cap, and she wore a different coffee filter on her head every day, just to have a little fun. And then he would speak to her because he didn't know any better. There's humor for perspective gaining, and there's humor. There are some people you work with, and I like you to think about them, that really have a flow about them. And when you work with them, because of their sense of humor, you often feel much more productive. Next slide. So what I have to offer you, this is sort of in summary, is the Daily Stoic website. I consider myself a proponent of Stoic philosophy. I read Stoic philosophy every day. I just love Epictetus and Marcus Aurelius, and learned about 20 years into my career that the principles of Stoicism were the underpinning of assertiveness training. And so here are just a few quotes to illustrate this philosophy. I know many of you are struggling in institutions, post-COVID. There's a lot of focus now on mindfulness in hospital organizations particularly. And I even recently worked and talked with a group of nurse administrators who were considering mandating mindfulness. Well, it's not something to mandate. You have to choose the way you're going to manage your stress based on your own personal preferences. So these just a few quotes. We suffer more in imagination than in reality. So really think about your thinking. Associate with people who improve you. The greatest remedy for anger is delay. Thinking about it. Working on what is really getting at you. Value your time more than your possessions. And finally, here's Epictetus on humor. If anyone tells you that a certain person speaks ill of you, do not make excuses about what is said of you, but answer, he was ignorant of my other faults, else he would not have mentioned these alone. Next slide. So this is my message to you. We can make ourselves miserable or make ourselves strong. The amount of work is the same. Thank you.
Thank you so much, Gloria. It's wonderful to have this actually nestled in the middle of our presentation. It was wonderful. Thank you so much. I just want to share one small little story about humor, because patients can be quite funny as well.
Mm-hmm.
Right. And I remember I was a relatively young nurse, and I was in coronary care, and I was assigned this patient. So I went in to do my initial assessment of him, and he was quite an elderly gentleman. And I said, "Hello, Mr. Smith. Do you know where you are?" And he just looks at me and smiles, and he says, "Of course I know where I am." And I said, "Where are you?" And he said, "Right here." He actually, that was the start of my shift, and he actually made my shift completely. And so, yeah, humor, I use that a lot, and I so appreciate your bringing that to light. Our third and final speaker we are so fortunate to have from Canada is Professor Leah Sanzone. She's an associate professor at McGill University in Montreal and director of both the undergraduate nursing program, the BSN program, and the nursing peer mentorship program. Professor Sanzone developed the Nightingale Fellows program, where graduating students are mentored by workplace clinicians who help them understand the challenges of the workplace and help them to develop strategies of resilience. Since 2021, she's been mentoring clinical partners with institutional transition to practice programs to help them support transitioning to their professional roles with the intent to increase retention. And Professor Sanzone is going to talk about those programs today. Welcome, Leah.
Thank you, Judy. So hello, everyone. I guess following Dr. Wicks and Dr. Donnelly's presentations, I'm going to kind of make that link between mentorship and resilience and talk to you a little bit about the different programs that I've been involved in regards to mentorship. So as you know, the definition of resilience is the capacity to not only cope with difficulties, but to recover from and overcome them. And like any other skills, it takes practice and attention to develop. It isn't something that happens overnight. It's something that happens with time. And as was mentioned by Gloria, you must have an intention to do so. The cultivation of future nursing leaders occurs primarily during a student's academic formative years of nursing school. Through active nursing organization memberships and peer mentoring experiences, student nurses acquire a skill set to prepare them for future leadership and to develop resilient skills. So mentorship relationships, it can happen just about anywhere, as we know. They don't need to be formal, they can be informal. So I'd start off with talking about mentorship in clinical settings. So literature review basically looks at it as a relational process, which contributes to a professional development of a protege. And this means that the person is guided and is supported by an older and more experienced or influential person. It's also described as a collegial supporting and guiding relationship. And of course, it's a strategy for career and role development. Next slide, please. Mentorship within academic or educational settings helps in dealing with the students' anxieties and lack of social and intellectual resources. Due to the lack of preparation for the rigorous nursing curriculums that our students must overcome or deal with, contributes to high attrition rates. And mentorships basically helps manage inadequate academic preparation, lack of social and academic resources, and anxiety faced by nursing students. And it may also increase student retention and success rates among nursing students. In one of the studies that we basically did within the school, we looked at the different sources of stress that happens with our nursing students. And interestingly enough, it came to our attention that in year one, students deal with management of academic courses. How do I deal with this course, time management, being on time, being ready, trying to just get that magical A, something that they're accustomed to getting and always want to maintain that top A. In the year two of their studies, the students were particularly concerned about high clinical performance expectations and now dealing with lack of time for their personal lives. So where is that balance of studies and personal life? Well, in year two, there doesn't seem to be much. And they're very concerned about their high performance in clinical. And in year three, where they're actually in the last year of graduation, students were particularly concerned about the prospect of graduating and transitioning into their work environment. Next slide, please. It is here that we developed in 2014 our Nursing Peer Mentorship Program. The Nursing Peer Mentorship Program is aimed at students who are transitioning into university and a professional and clinical study program. It's also mentorship for students in promoting them and helping them promote academic, social, and professional and mental health benefits, as well as personal growth. In this particular program, we match students so that there's dyads. So a student is paired with an older student. And we also offer various workshops based on what their specific needs are. Knowing what the top levels of source based on each respective year, it helped us develop as well different workshops that were pertinent to their needs. Dr. Dusher's book, From Surviving to Thriving, Navigating the First Year of Professional Nursing Practice, it is well highlighted the reasons why we need to prepare students for the challenges they face when they enter the workplace after graduation. The challenges for novice nurses are they have a challenge in asking for help. They're afraid to ask for help. They don't want to be mislabeled or misunderstood. They're feeling unprepared. They have difficulty managing the workload. They are also, unfortunately, experience bullying from coworkers. So thus, it becomes important for us to prepare our students appropriately. Why? For safe care for patients, self-care practices, and as well as we know, work-life balance. So students express basically the fact that they feel unprepared, they have challenges in managing the workload, there's a high risk of burnout and self-care, as was mentioned by Dr. Wicks, bullying from coworkers, as I mentioned before, and feeling afraid to ask for help because they don't want to come across as being unprepared. And there's also that magical conflict or gaps of what they learned in school and what they experienced in the clinical world. From here, we basically, all of that literature, we basically developed again in our school, the McGill's Nightingale Fellows Program. This is a program whose objective is to assist our nursing students who are graduating to help them transition to the clinical practice. We try to create an environment for students to discuss their transitions with other nurses. Our nurses in this case are clinicians clinicians from our multiple partners that we have within our circle at Montreal with McGill. And we basically offer group mentorship where we basically talk about different topics. The goal is really to support their transition and to provide a safe environment. In 2020, as you all know, we were hit by a famous friend called Mr. or Ms. or it COVID. It came to present itself, and through this all, many of our students, our graduates now, were forced to work in this not such a safe health environment or a known environment. As stated in Wicks and Donnelly's Overcoming Secondary Stress in Medical and Nursing Practice, while the lessons of COVID-19 extend to improving clinical environments and ameliorating the stress of the professionals' healthcare careers' most precious commodities, is that what it will do? Or will the pandemic experiences discourage others from seeking health professional careers? At this point, the graduates who had been through our programs were basically dealing with a lot of unknowns. They basically asked me if I could just kind of put together a different resilience support group for graduated clinicians. And we did. So we would meet weekly for about 2 hours. There was lots of humor, lots of laughter, especially after they spoke about all of the challenges that they were dealing with. As for our new graduates, dealing with the high levels of death that they had ever dealt with was something that was incredibly overwhelming to deal with. So in essence, our Nightingale program was evaluated, and it was clear from the different research studies that we did on it that it did facilitate the transition to the workplace after graduation. There are multiple implications for nursing management, that the partner with educational institutions to advocate for mentorship programs is very important. So to decrease that gap from university academic setting to the clinical world, and the continuation of this program as new graduates transition into their careers is also just as important. Again, we looked at different aspects with our students who graduated from our programs and participated in our nursing peer mentorship program. And here is where we found that fostering resilience in nursing students is an excellent strategy to reduce attrition rates when they enter the profession. Students' resilience is improved by creating peer support networks, teaching coping mechanisms, and boosting feelings of commitment to the nursing profession. They do not feel alone. They are part of a community. They are part of a profession. All nursing education institutions should invest in peer mentorship programs, is what was highly told to us by the students who had participated in this program. The next slide, please. Recently, I guess last year, we looked at exploring novice nurses' experience during the first wave of COVID-19 pandemic. While we did this, it was clear that 3 themes had emerged. Emotions that generated in the clinical workplace due to lack of control and the many unknowns of working as novice nurses during a pandemic. There was a cognitive dissonance of the nursing role regarding novice nurses' moral distress and their growing empowerment within the scope of practice. And lastly, a disconcerted image of nursing with contrasting views of nursing from the public's perspective and a disconnect between the frontline workers and the decision makers. Novel pedagogical strategies are needed to help novice nurses cope with stress, uncertainty, and role challenges to foster healthy learning and academic and working environments. It is this experience and many others findings that led us to develop the transitional mentorship program for new graduate nurses. This is done in collaboration with our clinical settings. It is here that we work together in helping our nurses, our new nurse graduates, develop organizational skills and time management skills, skills in the normal, abnormal continuum, help them prioritize and help them to delegate, to working on a team and with a team, expectations of a novice versus senior nurse, help them develop work-life balance, and lifestyle fluctuations with shift work, which affects everything in their personal lives, and of course, interprofessional relationships. In 2021, I started to work with one of our clinical partners. They developed what we call the first transitional mentorship program for newly hired graduate nurses. This was adapted from our Nightingale Fellows program. So basically what they did is they took the whole format, the whole approach, and we transferred it to the themes that were very appropriate to new nurse graduates. In 2021, of course, we were still quite fresh with COVID. So in 2021, we talked about the COVID-19 pandemic. What does it all mean to them? What were their fears? Did they have any resources, and so on and so forth. However, since then, we have moved on to ethical and moral development. What does that all mean? What does that all have an impact in their lives? We talk about stress management, different types of coping strategies. What is the most pertinent to them? So as was mentioned before, to enforce mindfulness on someone doesn't work for everyone. And everyone has their different ways of coping, and that is what we want them to do, engage in self-care. The third module focuses on transitional shock and the realities of the workplace. So there's this ideal world that you want to work in, and then there's the reality. So how do you deal with that shock? How do you deal with the transition shock? Fourth module is evolving within the organizational culture. As was mentioned, and as you all know, each organizational unit has its particular culture. And how do these new nurse graduates evolve in that while they develop their nursing profession and become who they are, the best of who they are? And of course, the last is taking a step back and looking towards the future. So what is it that they want to accomplish? Do they have particular goals that they want to achieve? So as resilience is a skill that is developed over time and is not something that is suddenly developed overnight, mentorship has a role throughout one's nursing journey. Using Patricia Benner's framework from novice to expert, which is using a scaffolding approach for mentorship, you could see that the programs that have been developed since 2014 are working with novice nurses who are joining our profession, so nursing students in the academic settings. There is a program of the Nursing Peer Mentorship Program that is available for them. For the advanced beginner, and this would be for the student who is transitioning from nursing student to new graduate nurse, there would be the Nightingale Fellows Program. And then for the competent practitioner, meaning the transitional mentorship program, it would be mentoring new graduate nurses. So as I put a closure to this presentation, I just wanted to say thank you very much. I know that time is quite short. I could have taken, as was mentioned before by Dr. Wicks and Dr. Donnelly, an hour just to talk about each program. But with that, I hope I was able to put forth different opportunities that you can all think about putting into place in regards to helping our nurses develop and foster throughout their nursing journey. Thank you very much.
Thanks so much, Leah. It was a wonderful tie together, that sort of pragmatic piece, along with some of the strategies that both Bob and Gloria shared. I'm so grateful to all of you for giving us that grounding, because it's one thing to think about resilience and how we cope theoretically and conceptually, and it's another to have some really basic ideas about what that can look like. We've got a couple of questions that have come in from the chat, and I'm wondering, we don't have too much time. We've got about 4 minutes to keep on our time schedule. So that might be perfect. You each get a minute to answer one of the following questions or add to. I'm wondering, Bob, if we can redirect this first one to you. And there's been some interest shown about your concept of post-traumatic growth. And I know you kind of touched on it. I'm wondering if you have any other examples that might resonate with the audience about what that would look like, post-traumatic growth.
The concept, it means that suffering need not be the last word. It can be actually the first word. Post-traumatic growth is when you deepen in ways after a trauma, in ways that would not have been possible had the trauma not happened in the first place. In my own case, a personal story, but my daughter had severe scoliosis that resulted in being in a an orthoplastic jacket 23 hours a day for 3 years, and then a surgery fusing 13 levels of her spine and having an iron bar put up her back. Well, I wondered what this would do to her because life is chronic. People said, is she okay after the surgery? Well, she crawled into the house later when she was in university, had to have the rod taken out. She almost died during her second pregnancy. But she said to me something interesting. When she was at university, she said, I wanted to be a Marine Corps officer like you were. I said, you did? And she laughed because she got the reaction she wanted. And she said, but I can't. So I said, what are you going to do? She said, I'm going to be a social worker and work in the Veterans Administration. And she did. And I knew post-traumatic growth was present because a vet came in with one leg blown off and she greeted him warmly in ways that I couldn't because I haven't been through her pain. And he said, boy, you're perky. And she looked him right in the eye and said, you've served our country well. Now you come on in and let us know what we can do for you. The nurses who have been through a lot have recognized it, been open to where it can take them. Those nurses are going to do dramatic things in their work.
Oh, Bob, that was beautiful. And thank you for sharing that personal story. I have often said that to my students that, yeah, nursing's hard. That's why you chose it. I mean, there's something inside you that wants to experience that kind of level of growth that can only come through suffering or suffering with. So thank you for sharing that.
Sure.
Gloria, I'm wondering if I can send this one to you. We always talk about, well, nursing is a very stressful profession. So what degree of stress is normative in nursing? And how do we recognize when we're like out of that particular space?
Well, I think if you can picture, it's not a normal curve. Let me put it that way. It's a curve with many peaks. And so I think new nursing students particularly experience a lot of stress because they're not prepared for the acuity, they're not prepared for the culture. And so right now I'm working with a group to design something like Leah talked about, but to do it while the student is a student, to assign staff, clinical nurse, clinical mentors to students, and then carry that through once they're finished their program. So I think it's uneven. I think there certainly are traumatic events that nurses experience that are very shaking. For me, in thinking about Bob's story and post-traumatic growth, about 10 years into my career, I was head of a diploma school and I got fired. And for protesting something that the CEO had done. I'm not sorry I protested, but maybe it wasn't the best way to go about sending my message back to the CEO. And they're the kinds of things you learn as you move along. What did I do? How did I end up in this situation? And what could I have done differently? And I did, and I got into more writing. It's better to publish your protests in a nursing journal because there's always some time between what happens and then the publication, and then people can reflect on it. So I think, nursing is stressful because you're dealing with life and death situations. You're dealing with pain, other people's pains, with families, and with administrators and managers. And which why I think humor is so important. You learn to roll with it. But yes, it is a stressful profession, but it's so rewarding. And you have to decide what the trade-offs are for you.
Yeah, thanks, Gloria. Thank you very much. Don't want you all to leave if you can hang on for another 3 or 4 minutes. I'd like to ask Leah a question, and then we want to offer up 2 books, and we'll do that to the audience that is here. All right. Well, Leah, I had one question that I might have come from an academic, but it's a question about how or what does academic support look like if you want to start a mentorship program? Like, how do you do that? How do you get support for that?
So I'll just basically describe my journey in this whole process. So when I first started to meet with new students who were struggling a little bit, and they expressed the need to have this some sort of a mentorship program way back in 2013, we started off, first of all, to see, was there a need for the whole student body? So we sent out a survey to all the students within the school. And interestingly enough, over 90% of the students expressed the need. So there I started off with having something to say. It isn't just my interest or a particular group of students. It really came from the student body. And then from that point on, I did bring it to our director of the school, but I also looked at within our university to see if there were some small funds that I could apply for. And I did. And I got a little measly, I started off with, I think it was $5,000. And I took that $5,000 and I started the program on my own. And, you know, where did the $5,000 go? Really, lots of pizza. Pizza, popcorn, come join us. And it was a lot of pizza. My director wasn't happy with our choice of food, but that's what students love, pizza. So the $5,000 went to the pizza, but it did allow us to started off with only 25 dyads. Within 2 years, we went up to 250 dyads. So with that, I also, you know, started collecting data. The program became a little bit more popular. Students started registering ahead of time to be mentors, mentees. And then from there, I also moved forward to apply for some more funding, larger funding, research fundings, and I was granted that money. But it is important to get the buy-in from your leader, from the director of the school, from your colleagues, faculty. It is so important. And then from that level, the word got around, and then other schools within the university reached out to us and, you know, how is this working? How come it's working? And so on and so forth. So many other schools and faculty within McGill did attempt to put this program into place. But I can tell you one thing. Out of the many schools that I met in different organizations, if you're to think about starting a mentorship program, the one thing that is to happen, continuity, sustainability. One person needs to be constant. Giving it to one faculty for 1 year and then they're not interested or they don't have the time, or giving it to a graduating student and then they graduate and they leave, has been one of the biggest barriers to the continuity and survival of this mentorship program. But I really do think to get the buy-in, so show a need, that there is a need within the school. And from that need, of course, if it's student-based, it always helps. Get the support from your leaders, from your colleagues, faculty, and have one person involved in it, and it's gonna work as it's worked for the last 10 years for us.
Fantastic, Leah. That's a real flagship for people when I know there are several people in the audience who also have a strong mentorship history, and it's nice to see that kind of growth in this issue. So I guess I'm going to stop there and thank this incredible panel. I would imagine that everyone is taking away some real gems with them. So thank you so much, everyone. And I think Kate is going to end us off with a draw. Kate, are you not?
Yes, I am. So I'm just going to spin it twice and then I will be in contact with the winners. Okay, here we go. Pause for effect.
Can you announce that number 29?
I will just shortly, okay?
Oh, super, thank you.
So number 29 and number 20, and I will message you right away, everyone.
Can you give do you have the names of those individuals, or?
I'll pull them from the list of participants.
Okay. Wonderful. Thanks so much, Kate. So that ends our NTF Live for this month. Thank you, Bob, Gloria, and Leah, for sharing your expertise and particularly your personal stories. Thank you so much.